This video is about hormone replacement therapy in females. HRT is a treatment to relieve symptoms of the menopause. It replaces hormones that are at a lower level as a woman approaches the menopause. It also has a positive influence on other long-term health problems associated with the menopause, such as the risk of osteoporosis, cardiovascular disease, and stroke. Benefits of HRT are that it improves vasomotor symptoms such as hot flushes, night sweats, palpitations, and headaches. It also improves psychological symptoms such as mood swings, anxiety, depressed mood, decreased libido, sleeplessness, irritability, forgetfulness, poor concentration, and fatigue. It increases vaginal secretions, thereby preventing vaginal dryness. It improves symptoms of urinary incontinence. There are some benefits on the heart as well. And HRT is the first line treatment for prevention and treatment of osteoporosis in postmenopausal women. Osteoporosis affects over 1/3 of all postmenopausal women. HRT can cause breast cancer. There is slight risk of breast cancer in patients taking HRT. Natural risk of developing breast cancer in women between the age of 50 to 70 years is 45 per thousand. This number increases to 47 with 5 years of HRT use, to 51 with 10 years, and to 57 per thousand with 15 years of HRT use. However, if a woman develops breast cancer whilst on HRT, the cancer is usually low grade with good prognosis. Second risk is venous thromboembolism. There is 2 to 4-fold increased risk of developing venous thromboembolism. HRT cannot be given if patient has endometrial cancer or breast cancer. Relative contraindications are severe uncontrolled hypertension and history of venous thromboembolism. In both these cases, avoid oral HRT, implant or patch is suitable. There are some minor side effects of HRT such as nausea and vomiting with oral tablets, then headaches, abdominal bloatedness, breast tenderness, fluid retention, and irregular vaginal bleeding, spotting, or discharge. These are noticed for the first few weeks and usually settle within the first 3 months. If irregular vaginal bleeding lasts for more than 3 months, the patient should be investigated to exclude endometrial cancer. With the patches, skin reaction can also occur in some patients. HRT can be given as oral tablets. Tablets are easy to take, cheaper, good control due to short half-life, wide choice of preparations, and it lowers serum cholesterol and LDL. But some disadvantages are that high dose of estrogen is required, variable absorption and metabolism, higher incidence of minor side effects, and patient have to take every day. All HRT tablets contain lactose and therefore not suitable for women with lactose intolerance. It increases triglyceride levels, and oral HRT may result in increased risk of venous and arterial thrombosis as compared to implants or patches. Transdermal patches, advantages are low dose is required, fewer side effects. It reduces serum triglycerides, cholesterol, LDL levels. It avoids intestine and liver metabolism, and so there is very low risk of venous thrombosis because low dose is required. Disadvantages are that skin reactions can occur. These patches are comparatively more expensive than tablets, and in hot weather these are not well tolerated because of sweating, and there is also variable absorption. Coming to implants, advantages are that 6-monthly insertion, high hormone levels in blood, and testosterone can also be added to the estrogen implant for decreased libido in addition to estrogen. Disadvantages are that this is a surgical procedure and we are not able to control absorption, and it cannot be removed once inserted. In hypertensive patients, avoid oral route. With history of thromboembolism, or if there is increased risk of venous thromboembolism, then again avoid oral route. Transdermal route might be preferable. In osteoporosis, if there is severe osteoporosis, use implant. If patient has loss of libido, add testosterone with estrogen implant. If patient has urogenital symptoms, give local estrogen cream or hormone ring. For gallbladder disease, if patient has gallbladder disease, do not give oral HRT. And if patient is taken liver enzyme inducing drugs, then again avoid oral HRT. HRT can be estrogen only HRT. This is for women who doesn't have a uterus. That is the woman who has had hysterectomy. Women with uterus should never be given estrogen alone. It can cause endometrial cancer. Women who have a uterus and are given estrogen in the form of patches or implants should be supplemented with oral or intrauterine progestogen. Then is combined HRT. This has estrogen and progesterone. Progesterone protects the uterus from developing cancer. Combined HRT can be of two types, which induces monthly withdrawal bleed. It is taken for 3 out of every 4 weeks, and withdrawal bleed occurs in the 4th week. Second type is no bleed HRT, and it is taken every day without a break. In women who have had menopause for less than 2 years and are of less than 55 years of age, give monthly withdrawal bleed inducing HRT. In women who have had menopause for more than 2 years and above age 55, they can be given option of bleed free or the monthly withdrawal bleed inducing HRT. Oral sequential combined HRT, 1 tablet is taken every day for 21 days, followed by a 7 days break in which withdrawal bleed occurs, and repeat the cycle every month. Oral continuous combined HRT, 1 tablet a day every day without a break. Patches, 1 patch once or twice weekly depending on the preparation anywhere on the body, and implant 50 to 100 milligram implant inserted into the subcutaneous tissue once every 6 months. HRT is given to menopausal and perimenopausal women. Menopause is when a woman is more than 40 years of age and has missed periods for more than 12 months. Average age of menopause in Britain is 51. Perimenopause is the 2-year period preceding the menopause when a woman usually has irregular or altered periods. Important points to ask in history when starting someone on HRT. Confirm the age and ask, have your period stopped when, and when was your last proper period? Are you experiencing any symptoms of menopause like hot flushes, sweating, these type of things? And ask about any mood changes, any urinary symptoms, and have you experienced any irregular bleeding? Do you have any medical conditions like heart disease, osteoporosis, and blood clots in your legs or lungs, or high blood pressure? Ask about lactose intolerance. Patient with lactose intolerance cannot be prescribed oral HRT. Ask, are you allergic to anything you know, including medicines or food? Are you on any medication? Remember that HRT interacts with tamoxifen, which is given for breast cancer, and some anti-epileptic medications such as lamotrigine can interfere with HRT. Also ask about, were you ever diagnosed with cancer of the breast or uterus? Have any of your close relatives have had cancer of the breast, bowel, or ovaries? Family history of these cancers might slightly increase the risk of cancer in this patient. Patient can still be prescribed HRT but must be warned about the slightly increased possible risk of breast cancer. Ask, have you had any operations like hysterectomy? And confirm that, do you have your uterus? Very important, safety netting. Tell the patient, if you experience any chest pain, shortness of breath, or pain or swelling in your legs, immediately call the ambulance and come to the A&E. Keep examining your breast on a regular basis and attend for breast screening when your GP advises you to. If you experience irregular bleeding which lasts for more than 3 months, you have to see your GP. Explain that the other side effects like sickness, bloatedness usually settle as you continue to take the medication. And this was all about HRT. Thank you for watching this video, and please subscribe to my channel and press the bell icon, and also press the like button. Thank you very much.